Okay, so I decided to do my case study on a 72-year-old female. She is 5'2", weighs 306 pounds, and was admitted on February 22nd, 2020. Her chief complaint was hypoxia and she was lethargic. So her admitting diagnosis was acute respiratory failure with hypoxia and hypercarbia. Uh, just some things to support her admitting diagnosis was her ABG was 7.28, 79, 88, and 36. And then she had some pneumonia, and her admitting SpO2 was 64%. So she was found at her nursing home lethargic, and her SpO2 again was set 64%. So she was taken to the hospital. She has an enlarged heart and it's causing her to have atelectasis and small lung volumes. She has a history of COPD. She's being prescribed the cocktail of Brovana, Pulmicort, and Duoneb. And the first day I saw her, she actually had to have a burp called on her because of her increased oxygenation needs. And her SpO2 was only at like 80 to 85%. And she was on the Airvo at 100% oxygen and 60 liters. Her code was DNR, so there really wasn't much we could do for her. Like, we couldn't intubate her because of her increased oxygenation needs. Um, and so we ended up placing her back on the BiPAP. She was going back and forth between the Airvo and the BiPAP, so we placed her back on the BiPAP, and we put her in AVAP so that that would go and like change along with her breaths. And then the second day I saw her, she seemed to be doing a lot better. She was sitting up. She was much more alert and awake. She was talking. Um, Her respiratory history showed COPD, OSA, and acute respiratory failure. She was a former smoker. I'm not for sure how long, but she had very severe COPD. Her medical history and surgical history included she had a pacemaker, an exacerbation of CHF, kidney disease stage 3, type 2 diabetes, hypertension, hyperlipidemia, OSA, AFib, depression, anxiety, and chronic pain. In her general appearance, she did not look how I thought she was going to look. I thought I was going to walk in that room and she was going to be using all her accessory muscles and trying so hard to work, but she wasn't working too hard. And she wasn't sweating or anything like that. Her skin was pink and warm, and she would go kind of back and forth between being lethargic and being alert. Like, the first day I was in there, she was more lethargic, and then the second day, she was way more alert, sitting up, everything. She had a regular breathing pattern, but her chest expansion was not symmetrical because you'll see on the chest X-ray, her left lung was like total white out, so there was no air moving through there, and she had edema in her legs and hands. Her vital signs were 108. Her respiratory rate was 17. Her SpO2 was going kind of in like 80s to 92s, depending on like what device she was on, like the Airvo or the BiPAP. Her blood pressure was 119/81. Her temperature was 96.4. Her lung sounds on the first day were coarse crackles on her right lung. And then her left lung was completely diminished and basically absent. And then she was having bronchospasm, atelectasis, and secretions. And then her coarse crackles indicated that she was having secretions. I was actually really surprised that she wasn't having any wheezing, but the cocktail we gave her was because of her history of COPD. Her diminished lung sounds indicate that she has atelectasis in her left lung. And then her lab values, her white blood cells were 9.43, which is normal. Red blood cells was 3.41, which is low. Hemoglobin was 11.1, which is low. Hematocrit 36.2, normal. Sodium 140, which is normal. Potassium 3.3, which is low. Chloride 103, which is normal. BUN was 69, and that's high. Creatinine was 1.65, which is high. Her glucose was 198, which is high. Her platelets are 245, normal. Her BNP was 11,000, which is high. Her lactate was 0.8, which is normal. And then Her ABG was 7.48, 49, 55, and 36, which is acute on chronic alkalosis. And then her connections, her BUN and her creatinine are high because of her kidney disease. And then her glucose is high because of her diabetes. And her diabetes and her high blood sugar because her body is either not making insulin properly or not using her insulin properly. And then her low hemoglobin is from, again, her kidney disease. And her high BNP means that her heart can't pump the way it should. So then, like, the higher the number of the BNP is, like, the more likely that heart failure is present. And she had a pretty enlarged heart, so I think her heart was working really, really hard, and so her BNP is really high. And her potassium levels could be low from vomiting, diarrhea, or excessive laxatives. Her chest x-ray, the doctor interpretation was her heart size is borderline, her pacemaker continues, there are small bilateral pleural effusions with bibasilar atelectasis, and her pulmonary vasculature is normal. She had an enlarged heart, atelectasis, small lung volumes, pleural effusions, right lung infiltrates, which indicated the pneumonia, and then her left lung is completely wide out. I'll post the chest x-rays on here so you guys can see them. And it's worsening day by day. Like the first one, you can see that she had, like, her left lung at the top, there was like a little bit of volume right here, but then the second one was completely wide out. She has CHF and is obese, and her hypertension is leading to her having an enlarged heart because her heart is just working so hard to pump everything through there. And because her heart's so big, it's pushing on her lungs. And so that's contributing to her atelectasis and contributing to her small lung volumes because it's just pushing. And the therapies that she was getting BHT, she had a flutter, she had CPT, and she was doing an EasyPap. And then her medications, these are the non-respiratory ones. She was on, I can't really say these, so I'm just going to try to pronounce them. She was on clonidine, which it allows her blood vessels to relax and her heart to beat more slowly and easily. And she was on this because of her high blood pressure and her AFib. And she took that every 4 hours. And then her citalopram. It's an antidepressant and it helps with her anxiety and her depression. Her furosemide, it prevents your body from absorbing too much salt, so it allows, like, the salt in your body to be passed through your urine. And she was taking that because of her edema and her swelling from CHF and also her kidney disease. And then gabapentin, it's used to treat seizures, but in her case, she was using it to treat her chronic pain, like her nerve pain. And then glucagon, it raises the concentration of glucose and fatty acids in the bloodstream. So what it does, it goes in and it stimulates, like, the stored glycogen that you have in your body, and so that turns into glucose and goes out into your bloodstream. And she's taking that for her diabetes. And then her respiratory meds, she's on the cocktail of Brovana. She takes that twice a day, and that's the indication for that is bronchoconstriction. Pulmicor, she takes that twice a day as well, and the indication is inflammation. And then Duoneb, she takes that 4 times a day, and that again is for bronchoconstriction. And a few side effects of these things can be tremors, tachycardia, increase in her blood pressure, nausea, dizziness, nervousness. And then evaluation of her therapies and everything that we're doing and the medications for her. Her lung sounds did improve a little bit on the right, and I think that also, like, the BiPAP and, like, getting all that air in there is helping open up her lungs. I think we could have been more aggressive with her, especially because her left side of her lung is completely wide out, and we could get in there with some more aggressive LVE and try to open her up as much as we could. And she actually told me she really, really liked the CPT, like the cupping. There was, like, this automatic thing that had it, Brian, and I would get down on her side and do it. And she said that it really helped her and she really liked it because she could feel those secretions moving. and they helped her cough them up, and so she really liked that. So I think, like, continue with that. Um, the severity of her respiratory condition was very severe, her complete whiteout of that left lung. And she went back and forth on the Airvo and the BiPAP, like, just having increasing oxygenation needs, even on 100%. And her short-term outcome, I think that we just try to open her up as much as possible, try to see if she could oxygenate any better, continue with her CPT to move those secretions. Um, just try to keep her comfortable and stable without using extreme measures, especially since she's a DNR, so you can't. And then the long term, the last day I saw her, her son and her did have a talk with palliative care, and they decided that it was time to place her on comfort cares because she was sitting up and everything, and she was like, I'm just so tired. I'm just so tired of everything. So, I mean, it's probably hard to just have all that air coming at you at once, and I don't know how long she would want to be on that for. It was actually really sad. She's like, "Can I go back to my my assisted living place soon if I get off this?" And she was just the sweetest little lady. But she was just on so much oxygen, and it was taking a lot just to support her breathing. And so for my disease process that I covered with her, um, actually, before I get to that, I left before they placed her on comfort cares. So I don't know how she's doing today. I'm hoping she's real good, but I mean, if they placed her on comfort cares, it probably went to end of life with her. And then for her disease process that I covered, I did CHF, and the expected patient presentation was pain in the chest, a dry cough, shortness of breath, increased respiratory rate, edema, reduced ability to exercise, increased need to urinate, lack of appetite, pink foamy mucus, fainting, and severe weakness. And how she actually presented, she had edema in her hands and legs, and her feet, and she had shortness of breath, increased respiratory rate, dry cough, weakness, chest pain, obese. And she had her chronic pain. Um, so we did place her on comfort cares, and she probably isn't with us today. But that is my care play.